Good afternoon, everyone, and welcome to the Memphis and Shelby County Joint COVID Task Force update. Today, as always, I'll give some data updates, but I also want to highlight some new guidance that's come out specifically about schools as well as around isolation and quarantine. Then we have two guests with us today. We have Jenny Bartlett-Prescott, who's going to give an update on testing. And then we have Dorcas Griffin, who's going to give an update on services and supports that are available to our community members that have been impacted by COVID. And then we'll open it up for questions and answers as we always do. As of today, we have 25,364 cases. I'm pleased to announce that's an increase of only 89 since yesterday. Unfortunately, we have had 334 deaths, but that still is about a 1.3% death rate, which is lower than the rest of the country, and that's remained stable throughout the pandemic. And we're very disappointed in any death, but are pleased that our death rate has continued to stay low. Our overall positivity rate for the pandemic is now at about 10.9%. But what's most promising is that we have had a steady decline in our positivity rate week to week since around the 4th of July, when we mandated masking through the health directive, as well as closed limited service restaurants. So we're now down to 13.5% for the past week. We want to get that to well below 10%, and once we get to 10%, we want to look at a 5% positivity rate. This is truly a reflection of our positivity rate and not testing capacity. As you'll hear shortly, we have significant capacity within Shelby County. Our recovery rate is at approximately 84%, so we have over 21,000 people who have recovered to date. And then the other promising news is that our reproductive rate is now below 1 and has been staying below 1 for several weeks, so that's a really promising sign. But what I want to point out is, while all of this is promising, it's really critical that we stay the course. It's difficult when it's beautiful weather outside and the majority of us feel well and see our numbers trending downward, that we want to get back to our normal, or what I'll call our pre-pandemic normal. And we really can't do that currently. We have to continue to stay focused on where we are, and we need to remain vigilant. We're going to be paying very close attention to schools opening and activities and outcomes related to that. And then also, as youth begin to play sports again, we're going to need to pay very close attention to that. So at the current time, we're going to stay the course, and there's a few things I want to highlight that we always highlight. It's really critical that we continue to social distance. I would challenge those of you who might want to go to a football game this Friday to think ahead of time about how you're going to social distance while you're there. Also, how you're going to continue to wear a mask throughout the game. It may mean taking a second mask with you in case your first mask gets wet or damp and therefore is no longer effective. And then also, some of you may need to make sound decisions about whether or not you should even attend an event, particularly sports-like events or other places where there will be significant numbers of people. And as a nurse, I'm always reminding people of the importance of hand washing, so continuing to wash your hands. But if you are attending any particular event, like a sports event this week, then you want to make sure that you have hand sanitizer with you, so that in the event you don't have access to soap and water, you can use hand sanitizer. Lastly, I want to reinforce the importance of protecting our most vulnerable. And in Shelby County, that's anyone over the age of 55, and then individuals with chronic illnesses, particularly heart disease, diabetes, or any respiratory illness. If we continue to do these things, I'm confident that our positivity rate will continue to go down and our transmission will continue to go down in Shelby County. So I want to give a few updates on schools. The Tennessee Department of Health has been updating their guidance fairly regularly, but I would also say now fairly frequently. As schools are getting back into face-to-face learning, some virtual learning, some mixed learning across the country, we're developing a lot of information and evidence that's going to inform what happens in Shelby County and in the state of Tennessee more broadly. So there is new guidance on screening of children. Previously, it was recommended that children be screened either prior to coming to school or at school. That's no longer recommended. That's informed by science. We know that children tend to have less symptoms than adults, tend to have more GI symptoms. But I would encourage parents, this has previously been stated, but it's a critical reminder that if your children are ill, please keep them at home. But we do know that screening is not going to be recommended. The other changes have to do with isolation and quarantine, which I'll talk about shortly, but that will impact how a school works with the health department to identify contacts and determine who can be in the school and who has to be excluded from school either because of isolation or quarantine. The other new information has to do specifically with isolation and quarantine. And as a reminder, when an individual tests positive, they're called a case. A case is isolated. So anyone who is ill, infectious, and poses a risk to others has to be isolated, not quarantined. Isolation is still 10 days from the onset of symptoms or 10 days from the date of the test. However, over time, we've reduced the number of days that a person has to be symptom-free, so that if a person had mild symptoms or no symptoms, they can return to work or school after 10 days of isolation if they are fever-free or symptom-free for 24 hours. So very much like the flu at this point, 24 hours fever-free without medication and 10 days isolation. For individuals who have had moderate symptoms to more severe symptoms, their isolation period may extend to well over 20 days, so it's important for employers to be prepared for that, for school systems to be prepared for that, and as well as for our community members to be prepared for that. In regards to quarantine, quarantine is still 14 days from the last contact. So for household contacts, that may mean 10 days for the isolation period of the case, plus 14 days for quarantine for the contact. And that's critical when we think about children in school. Some children may need to be excluded from school for up to 24 days total, depending on who they were exposed to in the household that was an original case. I do anticipate additional clarification and guidance from the state this week, and we'll continue to provide that to the school districts and encourage people to go to Shelby TN Health as well as the Tennessee Department of Health website. Then I wanted to just end with a little blurb on information and communication. I know there's always a public interest to learn more and hear more about what's happening in different organizations, including schools. But one of our responsibilities in healthcare and in public health is to assure the privacy of individuals. And so at the current time, relative to children in schools, we will not be releasing specific information on children or their school systems. We will, however, if the state issues different guidance, we will adhere to the state guidance on that. The state will begin publishing, if they haven't done so already today, will begin publishing the children in specific age brackets between 5 and 18 that have tested positive. So to give you a sense of the number of children in schools who have tested positive, and again, we'll adhere to the state guidance. So with that said, I'm going to turn it over to Jenny Bartlett-Prescott for a testing update, and then Dorcas Griffin will give an update, and then I will open it up to questions. Thank you.
Thank you, Dr. Haushalter. Good afternoon, everyone. I'm Jenny Bartlett-Prescott. I'm the Chief Operating Officer at Church Health, but also serve as the lead for the testing subcommittee specific for our community test sites on the Joint Task Force. So I'm here this afternoon to give you an update on where our community testing capacity stands today. All test sites have recovered from the issues we experienced in July that created reduced testing capacity. We are very thankful for that and happy to announce that. We're thankful for the collaboration and the cooperation that occurred among our local labs and our community test site partners to quickly resolve those issues and get us back to our normal test center capacity and operations. So currently we have the ability to perform 8,200 tests each week at 30 different test sites across Shelby County. We will continue to add new sites and partners for testing as those become available and as testing becomes more widely available. So please visit the website covid19.memphistn.gov so that you can find a site, if you do need to get tested, that works for you. We offer testing at multiple times of day, multiple days of the week, and of course multiple locations. So that site will remain our central place where we keep it up to date. We have added a column to all of our test site grids so that we are able to let parents know what ages are tested at each site. As Dr. Haushalter mentioned, with schools starting back with in-person learning, at least in some school locations, we know that will be a concern. We do have wide availability for testing for children, and that is not a concern as far as access at this point in time. It is important to call or text to get your appointment for testing. This allows us to continue to prioritize our scheduling so that we make sure that people with symptoms and people with known exposure to cases are able to be first in line to get tests. Currently, with the wide availability of testing across all of our sites, we do know, though, that cold and flu season is just a couple of months away, and of course, school starting back in session. It is possible that demand will increase again in the future. So we use data to inform our test sites about when we need to strategize and prioritize for testing and potentially have some limitations again for asymptomatic testing in the future. We are grateful for all of our partners. We're grateful for the wider community members of Memphis and Shelby County. You have been flexible. You have understood that we have to flex our test sites, and we have to flex to make sure that we can meet the needs where testing is needed most, and that can change from month to month. So we thank everyone for your understanding for that, but again, we're happy to make it clear today that we have wide testing availability throughout the county. Thank you.
Good afternoon. My name is Dorcas Griffin. I am the Director for the Division of Community Services for Shelby County Government. I am just here briefly to talk to you about some of the services that are available here in Memphis and Shelby County during this time of COVID. As many of you might recall, on March 13th, MLGW made the decision to put a moratorium on any cutoffs and late fees for all customers in this region. On August 24th, which is next week, that moratorium will be lifted. We recognize that in spite of the moratorium being lifted, there are still many people who may be struggling, who may have bills that have piled up because of the economic downturn that has happened in their personal lives and within the community. And so we want to make sure that we are clear with everyone that we are still available to help people with services as they need them. I want to give you a couple of resources that can help folks with emergency assistance payments. One of those resources is our Shelby County Community Services Agency. We are able to help households with up to $650 towards their utility bills based on their income or lack of income. And so I encourage you to check out the website at shelbycountycsa.org and go to the utility assistance portion. You will find an application where you will be able to apply. You will be able to print out the application, mail it in, bring it in, and we will work to get you processed. Another program that's available here in Shelby County is through MIFA. MIFA provides one-time emergency utility assistance through the MLGW Plus One program. For more information about that program, you should go to the MIFA website at www.mifa.org and hit their Emergency Assistance Eligibility tab. The final resource of assistance that I want to mention is through the state of Tennessee. Many of you will recall that there was an emergency cash assistance program that was unveiled for individuals and families who have lost income because of COVID. If you go to the Tennessee Department of Human Services website, you will note that there is an application for individuals and families to make an application for this assistance. While the application deadline was supposed to end prior in a couple of months ago, it has been extended to August 29th. And so we want to encourage anyone who might be eligible to go on and apply and get the assistance that you need. I do want to say, I want to thank this community for just being patient and having grace for us during this time. There are many people who are struggling. There are many people who are trying to access services every day. And I know sometimes it may be frustrating as you get busy signals, as you wait to find out if you can get help. And so I just thank the community for being patient with us as we process applications, as we work to ensure that every person in this community can get the help and assistance that they need. I encourage you not to wait until the last minute. August 24th is coming, and so we want to make sure that as kids are going back to school virtually and in person, as our college students are having classes in different ways and forms, as people are returning back to work and continuing to work remotely, that everyone has the energy that they need to get their job and their work done. Thank you.
Thank you, Dorcas and Jenny. We'll open it up for questions.
Catherine Burgess, Commercial Appeal.
Hi, I hope you guys are all doing well today. My first question, I'm wondering, with case counts, of course, increasing in our surrounding counties and also hospitalizations increasing in some area hospitals outside our city, I've heard about concerns in Jackson, Madison County in general. I've heard about some concerns in hospitals in Oxford. If hospitals in surrounding areas are stretched to capacity, do the excess patients come here? And then what would that mean for us? Is that a current pressing concern?
Thank you. That's a good question, and I hope you're doing well. I'm doing well, and I think the whole group is, so thank you for that question. Generally, each hospital system will have a partner organization where it can transfer patients. So there is a possibility that patients could be moved from Jackson, Madison to the Shelby County area if needed. But at the current time, that is not impacting our system. And then I also want to remind everybody, within the Joint Task Force, we actually have a membership from the surrounding counties, and that not only are we aware of what's happening in the surrounding counties, but when those counties also need assistance from Shelby County, or we can share a lesson learned, we share that so that they can get on the right track as well relative to COVID. So great question, but at the current time, there's no particular concerns that we have within Shelby County.
Awesome. I'm glad to hear that. I guess my follow-up would be, which hospitals or cities, however it works, are we partnered with that we should kind of be keeping an eye on in terms of capacity to see whether it will eventually come in?
Yeah, honestly, for hospitals specifically, I wouldn't answer the question on that, because each hospital would have to answer for themselves how they receive patients from other facilities, particularly outside of the region. As far as the Joint Task Force, all of the counties that immediately surround Shelby County actively participate. And then I know one of the mayors on that call that's from a rural county also has some relationship with Jackson Madison, and then we have representation from Arkansas as well as Mississippi on the call. So I do think as much as we can, we've taken a regional approach to learning and implementing policies and practices to reduce COVID transmission.
Tony Sloan, Box 13. Tony Sloan, Box 13. Brad Broders, Local 24.
Good afternoon, everyone. This question goes to Dr. Haushalter. Hope you all are doing well. To follow up on Catherine, you probably heard this morning, Harding, 11 athletes have tested positive for COVID-19. In your view, I know you all are pretty outspoken about your concerns about fall contact sports. Does this, in your view, potentially have any impact on other districts potentially reconsidering fall contact sports? Then I have a follow-up.
So at the current time, I'm not aware of whether or not other districts or any other private schools are reconsidering their plans. I will reiterate what we said early on. We felt that in Shelby County, when I say we, it's not only the health department, it's the Back to Business group, as well as Dr. McCullers, who is on the Back to Business group with us, and a pediatric infectious disease specialist. We did not recommend contact sports at the current time. So anytime we see a large number of young people who are impacted that are, we know, engaged in the same sport or have been in close contact, that's disconcerting to us. I think we'll continue to watch across the county, and I trust that all of the school districts will use information to guide their decision-making locally. And your follow-up, please.
Thanks, Dr. Haushalter. I know you or Jenny Bartlett-Prescott can answer this follow-up as well. You made the announcement of the changing of priorities 4 Tuesdays ago on July 21st. The 14-day testing average is down nearly 30%. What would you attribute this to? And I know you all were talking about capacity. Do you feel like it's time to open it back up to asymptomatic testing, or do you feel like you need to hold these slots potentially more for children who may have symptoms to be tested?
So I'll start, and then I'm going to turn it over to Jenny to give some additional information. At the current time, we actually think demand is down for 2 reasons. One, we probably have less people who are physically ill or symptomatic who are seeking testing, but also we know that around the 4th of July holiday, a lot of people were seeking testing, really I would say as an assurance measure around the holiday, and so we will see ups and down patterns, we believe, throughout the pandemic. And then I'm going to let Jenny speak specifically to priorities, and she can also give an update on how we look at priorities week to week.
Thank you for the question and the opportunity to clarify. So yes, because our test sites are what we call status green, which means that our utilization is not exceeding 70%, it allows us, when people are calling in and scheduling a testing appointment, it allows the call centers at each of our test sites to go ahead and book those appointments for people who maybe do not have symptoms or don't have a known exposure, so what we would call asymptomatic. This is a moving target, so one of the challenges for us is in making public announcements that then we know could potentially change in just 2 to 3 weeks. As we just heard, we're starting to see some positive cases coming out of fall contact sports, and so all of our test sites are kind of aligned and coordinated to pay attention to our capacity. We meet every Monday, we review our utilization from the previous week, and then we make sure that across our test sites we're all following kind of the same prioritization matrix to make sure that folks with symptoms and people with known exposures are getting appointments first. That is also why I was trying to emphasize for people to call in and make appointments instead of just showing up. That gives us a chance to kind of go through that priority matrix when folks are calling in, just to make sure that we're reserving those appointments where it's needed most. We also are looking at where cases are happening in our county, and we're looking at where we see an increased rate of cases, and we're comparing that to where we are seeing testing uptake and utilization, so that now that we have a bit more capacity at our test sites, we hope that we'll be able to start coordinating some special testing events with our community test sites where we can go to where there may be a need and try to really focus in areas or in populations where we know we need additional testing capacity. We were doing that before July, if everyone remembers hearing kind of about some of these special event testing events, and we hope to be able to get back to that. We are being a bit cautious right now while we see how the schools coming back into session and then the fall sports play out with demand at our test sites.
Kendall Downing, WMC.
Hey everyone, this question is for Director Haushalter. I was wondering if the health department has set up with the contact tracers, is there a specific organizational change that will be looking at just cases that are in schools? And I know you mentioned that you all would not be reporting specific schools, but would those be investigated under your purview like the nursing home and like the cluster outbreaks? And then I do have a follow-up.
Yes, definitely they would be investigated just like any other cluster outbreak, whether it's a nursing home, a jail facility, or any other high-risk facility. Within the organizational structure, remember we added 141 team members. We're looking to add even more. We have some teams that are dedicated to what we call vulnerable populations. One of those is dedicated to nursing homes, one to jails and congregate settings, one more to community outreach. The fourth team we're actually looking at dedicating to schools specifically. In part, we anticipate there will be clusters, but we also know there's a lot of technical assistance that may be needed by the schools. We've been doing that already, but that's really fallen mostly to me or Dr. Randolph, and so we want to have dedicated individuals that can provide support to the school. So yes, we will be doing that. And then just a reminder that contact investigations is really the purview of a health department. It's a statutory responsibility. But while it is our responsibility to carry out case investigations and contact tracing, we look very closely and partner with schools and others to help identify contacts earlier. So we have been in partnership with the schools. We'll continue to be in close partnership with the schools. And it's really going to take the schools as well as the health department and families to be able to identify contacts quickly and get them quarantined. And your follow-up, please?
Yes. I was wondering, obviously we mentioned the Harding cases. Are there recommendations for schools to safely conduct athletics? I know you all have said that you don't believe that they should continue, but what are things that schools should be doing if they are going to allow them to take place, and procedures that they most definitely need to be following? Thank you.
So we really have referred the coaches as well as the school directors and superintendents to look at the TSSAA guidance as well as the state health department guidance, which provides a lot more detail related to specific contact sports. But the key things really are applying principles to the sport itself. So an example is, how do you social distance athletes? How do you potentially practice in small cohorts so that you're not having as many people exposed if someone does become positive? Clearly, there's been recommendations not to remove the helmets during football, but I also know really just in a matter of weeks, the industry has responded and created shields for the helmets and other things, new types of mouthpieces and so on that are designed to reduce the ability to actually expectorate the germs. And so I think we're going to see both what we would call environmental change. Again, how do you cohort small groups for practice? How do you assure social distancing? You don't share water bottles, all those other things that to me are fairly common sense given the basic principles of reducing transmission. But you're also going to see the industry do some engineering, particularly around, again, the face shields in football and others. The other thing is that as we move forward and testing is more widely available and new types of testing is coming to the market, we'll also see testing playing a significant role in determining whether or not an athlete can safely play or not play. Then something we haven't talked about, but I'm going to highlight it here, is that it's really important that we keep young people healthy in general. Contact sports is very taxing on young people, so I would also say as parents, making sure that children are eating well, and that means healthy, nutritious meals, that they're getting sufficient rest, and as we move into flu season, to assure that they get their flu vaccine as well. That way, if they do become infected, they're not as likely to become ill. There are also recommendations for follow-up if a young person has been diagnosed with COVID, and I would refer people again to the TSSAA guidance as well as the State Health Department and the AAP. Thank you.
Jane Roberts, Daily Memphian.
withdraw my question. Thanks.
Katie Reardon, WKNO.
Hi there, quick question for Jenny. I'm curious, the number that you threw out of the 8,200 tests per week, that includes both community and private sites like Walgreens, or what does that number entail? And then also, what does that number need to get up to as we do, or what do you anticipate it needs to get up to as we do head into cold and flu season?
So good question. The 8,200 is both our kind of community test sites that are based off of our safety net clinics and University Clinical Health. That's the group that meets every week and is responding to where the need is. But it also does include those commercial and private partners. The Walgreens, the CVS, MedPost Urgent Care, and there's also other private clinics, which I definitely encourage. Those are happening more and more, where private doctors' offices are starting to offer COVID testing for the public who wants it, and so we are happy to list that on our site, which we can make sure that stays up to date if other private clinics are out there and want to make sure their information is listed. As far as what that number needs to get to, I mean, that is the golden question. That is why we are managing based on demand and managing based on what we are seeing coming to our test sites. As Dr. Haushalter mentioned, we are hopeful that testing will become easier and easier with modalities. There's, of course, national news being made right now about a Yale study with saliva tests. As the science gets more firm on those, and we are actually doing some testing of a saliva-based option here in town, we'll be able to respond and be even more flexible with how we can collect specimens safely in multiple settings. We're not ready to do that right now, but we are definitely planning towards cold and flu season in our safety net group to make sure that our testing capacity remains enough to meet the demand.
We are out of time. Are there any closing messages?
No closing messages from us other than thank you for your flexibility and your understanding and patience.
Thanks, everyone.
Do you have anything?